Thanks, Patrick. Our first presenter is Steffi Chenu-Johns, and she is going to be presenting her APE on the preliminary catalog for care coordination in Montana. And Steffi's site mentor is Kim Brown, and she is the Montana Transition Resource Director at the University of Montana's Rural Institute for Inclusive Communities in the Montana Deafblind Project, as she's the co-director there. So Steffi, I'll let you take it away.
Thank you, Lee. I hope you can hear me okay. All right. Good afternoon, everyone. My name is Steffi Chenu-Johns, and I will be presenting my applied practice experience on building a preliminary catalog for care coordination in Montana. So I was introduced to the National Care Coordination Academy and the Montana team through my site mentor, Kim Brown. This is an interdisciplinary team working towards the implementation of care coordination. Care coordination and case management are two terms that are used interchangeably. Providers and parents alike understand them differently, and the scope of care coordination and its varied service components are often difficult to remember. So the need of this project was primarily to clarify terminology, and we needed to hear back from various providers within the state for this purpose. So our plan of action was to create a network of providers in Montana who can contribute to defining the various service components of care coordination. Secondly, to develop a catalog for providers with contact information of various healthcare facilities or practices, and include details about their care coordination service components, program funding, logistics, etc. Based on this, my first APE product was to build a survey form. The second one was a multimedia presentation where I presented the project idea to the Montana team at their monthly virtual meeting. The third product was a survey analysis report that can serve as a resource for future work related to care coordination. So we were discussing about three outcomes with regard to the project value. We hope to build the care delivery system through a project such as this. And secondly, we hope to strengthen the in-state provider networks. And finally, provide more funding opportunities. And with that, we were hoping that we'd be able to improve provider knowledge about payment models, delivery systems, so that they'd be able to have a better understanding when they're applying for waivers and grants, and figuring out various ways to obtain reimbursements for care coordination activities. My APE products helped me achieve the following competencies in the MTH program. Competency number 7 was met by building contacts, identifying a target population, designing, promoting, and distributing the survey. Competency number 8 was met when we edited the survey form together with our team members, and a lot of input from others who helped us out. And competency number 19 was met by the multimedia presentation that I did, where we were able to talk about the importance of this project as well as the limitations. The survey promotion material included a logo as well as a survey blurb that we had made together. The concentration specific competencies, number 2, was met by our plans for survey distribution, which also included some amount of research into the specific challenges in Eastern Montana with regard to care coordination. Competency number 4 was again met as we were pursuing these two products. We were able to identify social determinants of health with regard to care coordination. I'll give you a quick overview of how we went about with developing the survey. First off, it was difficult to identify a target population. The right person to deliver care or to coordinate care will be different for different patients. It depends on the patient's unique health condition. So we had a wide range of job titles to consider: doctors, nurses, case managers, social workers, all practice care coordination. And this was one of our greatest challenges with regard to developing the survey. With regard to service location, we hope to reach out to all facilities and practices within the state. We made several attempts to reach out to tribal reservations as well, but we were unable to establish contact. Although there is a general shortage of staff throughout the state, with regard to Eastern Montana, we found that the provider to county ratio varies from 1:1 to as high as 1:5, with one provider serving for 5 counties in Eastern Montana. There is also a higher staff turnover rate, especially within the tribal reservations. The mode of distribution was through email. We also mailed promotion letters to facility addresses. We did anticipate a low survey response rate, especially because of COVID. And as we went about building contacts, we adopted the approach of warm handouts. We tried to get to survey respondents through familiar routes, approaching the different associations. In particular, Montana Hospital Association helped us out by promoting the survey in 2 of their weekly publications. Apart from this, we also published the survey on the Rural Institute website and their Facebook pages. We also got in touch with WIM Tracking and Connect. There were resources for us to reach out to as we built the contact list. A quick outline of my survey itself. It had 2 main sections. The first section had 12 open-ended questions that focused on the respondents' place of work, their understanding of care coordination definitions and duties, their knowledge of referrals and funding sources, their perceived barriers to treatment access, a question about the age range of patients that they serve, a couple of questions about logistics and location, as well as a final consent for inclusion into the catalog, following which they'd go into the optional contact information section. So we identified, as part of our survey analysis, we identified 12 service components for care coordination. A care coordinator connects patients to service providers by making appropriate referrals. They link patients to community resources, arranges for appropriate patient follow-up with a primary care or a specialist. They serve as a liaison between 2 providers and coordinate appointment scheduling for the patient. They identify barriers to treatment access and works out solutions together with the patient and their family. They ensure that there's home-based support available for the patient. They design care plans and regularly update those care plans and ensure timely completion of patient assessments, support the patient's self-management goals, help with transitions of care, and organize and store all the care coordination records for their assigned patient. The most common barrier that we found as part of our survey analysis was gaps in services. And this is followed by payer system problems, inadequate staffing, insufficient resources, lack of communication between providers, fewer referrals, and duplication in services. And apart from these choices, there was one respondent who commented saying that they have difficulty obtaining records from other providers, especially out of state. And another said that there is a lack of appropriate facilities for higher level of care. So these are 4 factors that affect care coordination for children with complex care needs in rural Montana. Firstly, low levels of personal and organizational health literacy, a payer system that does not exactly incentivize for care coordination activities. Thirdly, problems with community infrastructure. And finally, geographical distancing, leading to an inability to access the care services. We found out that in far eastern counties of Montana, patients prefer to travel out of state to receive care services rather than drive miles into the center, into the state center. I would like to conclude by talking about my limitations in this project. Firstly, as I'd mentioned before, it was difficult to define a target population. We had an undetermined number of care providers. There were barriers to provider access, and then unknown variables that we couldn't exactly measure. The survey response rate was less than 1.7%, and a few possible reasons for this could include this being a non-incentive based survey, lack of time, probably because of increasing workload on one side, and then maybe because of the increasing number of survey requests that are going out now in healthcare post-COVID. And finally, a lack of awareness about various service components of care coordination. As part of my community service, I participated in the University United Food Friday event held on October 8th at the UC Ballroom. I was part of the packing team for packing meals for distribution to youth and their families through Missoula Food Bank's Empower Pack Weekend Nutrition Program. I'd like to take a moment to thank Professor Harris, who had also helped us with survey edits. And I'd also like to thank both my mentors, and especially Kim. Thank you for all that I was able to learn from you, all that you were able to teach me over the past few months. Are there any questions?
Thanks, Steffi. That was great. Does anybody have any questions for Steffi right now? I will add that I'm just way impressed on how organized you've been throughout the whole semester, and just taking this project on way back before Christmas even, because you knew you were going to be in India, which is where Steffi is calling in from to do this report. So between your organization and your technology savviness, congratulations on a job really well done. So does anybody have a comment or question for Steffi? Go ahead, Kim.
I just had a quick comment. Hi, Steffi. I don't know if folks have an understanding of what a gargantuan undertaking this actually was. There have been a number of people over the years at the state, at the university, who have attempted to define care coordination for children with complex care needs, and have always ended up stopping because it's been such an unwieldy octopus to try to get their arms around. And so for Steffi to just jump in, take this on, and as Professor Taggart said, to do it in such an organized fashion, I really am deeply honored for the opportunity I've had to work alongside you, and amazed at what you've been able to accomplish. So thank you for the chance.
Thank you, Kim.
Thanks, Kim. We probably have time for one more question or comment, if anybody wants to jump in. Oh, okay. Well, thanks, Steffi. I'm going to let Patrick stop recording, and we'll take a little break here, a